for this very important session we have planned on the COVID-19 Academies platform, which is a joint collaboration of WHO, UNICEF, World Food Program, and HCL Foundation. Today we are blessed to have like a very important session, which is on the topic unlocking challenges, opportunities, and lessons learned. So we have been joined by an eminent set of panel today, starting with our very own Professor Santosh Kumar, Professor and Head Governance, Policy Planning and Inclusive DRR from National Institute of Disaster Management. Professor Santosh is a DRR Policy Planning and Capacity Development expert with 25 years of experience in different positions in the development planning and DRR sector. He is a PhD in economics. He studied gender and development in IDS, Sussex, UK, and received professional training in disaster management from Israel, backed with international work exposure at the World Bank and intergovernmental body of SARC. He has also worked at state levels in different capacities in UP Academy of Administration, Nainital, and RIPA, Jaipur. He is an experienced hand in designing, planning, and implementation, mitigation, and long-term disaster recovery plan and project. We will be Professor Santosh will be joining us shortly. So in his absence also, I would like to welcome Professor Santosh for our session. We also have Dr. Gita Verma with us today. Dr. Gita is currently heading the Girls Education Program in Care India. She is currently, as I said, working with Care India, where she provides strategic and technical guidance to education portfolio of the organization. She is an educationalist by training and have been technically experimenting, designing, and guiding school quality education programs to address educational needs of most marginalized children for close to 2 decades. Her primary interest lies in exploring issues of gender, learning, and marginalization. She has a doctorate from Zakir Hussain Center of Education Studies, JNU. I heartily welcome you, Dr. Gita. We also have been joined by Mr. Manjeet Saluja, who is currently working as the National Professional Officer in WHO India. Mr. Saluja has been working in the area of environment and development since last 2 decades. He is currently working with the WHO country office and heading as a technical officer for environmental health that includes issues of water and sanitation, climate change, air pollution, chemicals, and its effects on public health. He has been closely coordinating the efforts of WHO country office with the Ministry of Health and Family Welfare and the UN partners. He has previously worked for the Indo-German Environment Partnership Program, UNDP, Planning Department, Government of UP, and various international and national NGOs in various states of India. I would like to welcome Mr. Manjeet for this session. We also have Dr. Jugal Kishore with us. I'm not really sure whether he has joined us. Yes, I can see Dr. Jugal Kishore. So Dr. Jugal Kishore is the Director Professor and HOD at VMMC and Safdarjung Hospital. Dr. Jugal is a medical educator and public health expert. His more than 270 research papers are published in journals, in magazines, and in dailies. He has authored 34 books and many chapters and pamphlets on public health, national programs, social reforms, and rationality. He is a member of many expert groups of health planning and implementation of program of the central state government and various institutes. I also got to know that Dr. Jugal is currently having some exams today till he managed the time and joined us today. Thank you so much, Dr. Jugal, and we heartily welcome you. I can see Professor Santosh, sir. We already welcome you, sir. Once again, we would like to welcome you for our session.
Listening to your welcome. Thank you very much.
Thank you, sir. Okay, so last but not the least, our moderator for the day would be Ms. Valerie Agarwal, Program Manager from Spare India. Ms. Valerie is a humanitarian professional with more than 5 years of national and international experience across 10 Indian states and 2 countries in disaster management, emergency capacity building, multi-stakeholder project management, and community organization. She has an academic background of economics, social work, and international humanitarian law. I would like to welcome Valerie and hand over the stage to Valerie to take the session forward. Over to you, Valerie.
Thank you, Siljo. And once again, welcome all of the panelists to the session. I would also like to welcome all our participants who have joined us today. Today's session, am I audible, Siljo?
Yes, totally.
Thank you. Today's session is on unlocking and the challenges, opportunities, as well as the lessons learned while we are unlocking. So, as all of us know, the COVID 19 crisis has affected societies and economies across the globe. And it will continue to reshape our world as we get into the new normal, as the situations continue to unfold. However, while the fallout from the crisis is both amplifying familiar risks and creating new ones, uh, it's also creating new opportunities, new openings for managing systemic challenges, and we can also explore ways to build back better. So from this panel discussion, what we aim to do is that we would like to understand the challenges as well as the opportunities that are awaiting us in this current unlocking phase after the second wave, and how these lessons learned from the past 1.5 years can prevent us from entering another situation of a lockdown and another catastrophic wave that we just saw in the second wave. With that, I would just like to explain the pattern of this panel discussion. We have 4 panelists with us, and we will be going back and forth with questions to these panelists. And while my question might be addressed to one of the panelists, the other panelists are free to sort of, complement the answers, or if they would like to add, that would be great. So with that, I would like to ask my first question to Professor Santosh, because that will also help us set a little bit of context to this session. And my first question would be, that's a, the pandemic on a global level has caused a lot of loss of life and disruption to the economies, to human lives, to the nations. So if we try to introspect, then at a global level and also at the individual or country levels, what didn't go right? And why did this result into such a catastrophic event in the form of a global pandemic in the first place?
Uh, Thank you very much for asking this question. This is very important to understand that how much we are careful and concerned about the information available already. So like when we talk about this pandemic also, I was reading a book and report on pandemic published by the World Bank. Almost 10 years ago, it was mentioned that globe is likely to be affected by serious pandemic as a kind of a global pandemic. And they have highlighted also that likely economic loss would be around $3 to $5 trillion. So that was 10 years ago mentioned in the report. 10 years, all the global economy and the leaders of the world, this information was not taken care of well in terms of preparedness. So if that information would have been there, it is there, would have been taken into planning for the public health system. We have Dr. Saab with us, and Jugal Kishore ji. So he would be definitely there to cross this point which I'm saying. But this is one point which I wanted to bring, that how much information which is available is important to us for the planning, number one. Number two, when this all got affected in the first wave pandemic, few countries performed exceptionally well because they had this experience of SARS and other kind of epidemic there in the country. So that was another story. And the third is this, that whole of the kind of 176 countries got affected seriously, starting from Wuhan to current story, which is we are talking about. But after the first wave, the stories are still different with the second wave. Second wave story is not the same for all the countries of the world. First wave, they could do better. And after that, they learned and they could execute of the learning of the first wave to the second wave. So that the second wave, even if it emerged, it was not that devastating as we had in India. So in the second wave also, that we see that Cambodia, we should see Japan, and we also see Vietnam, New Zealand. These countries, even Germany, Australia, they performed well. So meaning thereby that every country has a different learning curve. And that learning curve determines the output of the pandemic, that how severe it is. like the second wave of India was unmanageable for everyone, whether the household level, the community level, the institutional level, and also at the government level, governance level. So we need to correct our whole strategy for if we are waiting for the third wave. And then third wave, when we are unlocking learning, then we say that on what are the second waves learning, which we did mistake in the second wave, what are the things which we unlearn, and that is that important that we should handle third wave very carefully and very kind. So this kind of a scenario, that pandemic, along with other disasters which are happening, the cyclones and all, the cascading impact of other disasters should also be taken into account. So pandemic is there, vaccination is still to be taken care of. Only 10 to 12 crores of total population have been vaccinated. So the fight is really difficult, and the kind of vaccination process which is going on probably help. But if it is delayed, then again we will be having some trouble. But this has given a chance to leverage upon strengthening our own health system. So Jugal Kishorji would be there to mention, and also Manjeet ji is there. He can also say that what is that experience which is going on. And so I would stop here for the first encounter and the questions which you have said. I just said that one point that existing information must be acknowledged for the planning. It should not be ignored. And once it was ignored, the consequences was very, very severe. We lost millions of people across the globe. And also that billions of dollars, rather trillions of dollars, and its consequences is much more now, because many people have gone into poverty trap. Many have gone into unemployment. Many have gone into a kind of a trauma. Many have gone into a kind of orphans, their children have become orphans. So that consequences are very, very, it's not that confining to one kind of a one wave is over, and the consequences of wave one is still there. The consequences of the second wave is also there. So there we need to look at that, how other information are important. Thank you.
Right. Thank you, sir. Building on that, my next question was actually going to be to Dr. Jugal Kishore himself. And as you had mentioned, I wanted to understand from you, Dr. Jugal, about the stresses that the healthcare system has faced due to this global pandemic. And again, drawing on to the question that I had asked to Dr. Santosh as well, was there something that we could have done better in terms of preparing our healthcare systems for this intensity of a pandemic?
Thank you for this question. Saying that we could have done better, we can always say we could have done better. Disaster is like that, you have to do your best. And if you are prepared, you are much better responding things, but you learn from whatever you have done. So what we have, gone through this whole pandemic, although we have witnessed, in last decade, the H1n1 pandemic. So we had some understanding of how to deal with, but this pandemic is a little different because of its nature and the countries involved. That is why this is a little different. And then the second wave, and maybe I think we are now expecting the third wave. One is that, the spread of the virus always go through the borders. And because of, we have very high level of travel by air and other routes. That is why the transmission was so fast. Within a few days, we found that this was there in many of the countries, and also within the country, then various states were involved. So somewhere now it has become difficult that we can stop something at the border. If you look at the Delta, variant, which was more common in Indian, states, but recent data is showing that it is already there in 30 and 40 countries. So you can imagine that in spite of so much, decrease of the air travel, the transmission of this, or say that, infectivity of this virus is such that it has reached to different countries. So that is also learning that, somehow our practices all the time has to be uniform. It should not be erratic, or it should not be that if you are suffering from something, then you do something, otherwise you just forget. That is what we have learned. Somehow I can say that the behavior of the people is a very interesting learning for us, because the behavior of the people is the main cause of the transmission in the second wave. If we look at it, the first wave also, and then in Delhi we have the 4 waves, and then every wave was associated with some kind of behavior of the humans, because they were interacting, they were celebrating, they were organizing many things. So and everybody's involved in it. So because of that, the transmission was there. We know that transmission of the virus is through one-to-one person. So if we could have limited our interaction, I think we could have limited that one very well, but it was not done. And again, what we are finding in third wave, that some of the states, you can see again such kind of activity which has been condemned by all over. In spite of those all things, again the human behavior is main target again. They are not learning from. So what you say learning, I don't think learning is making any sense. Even so much death has occurred, so much turmoil was there. I can imagine, my phone was ringing through morning to night to 12 o'clock. Even at 12 o'clock, I used to have the ring of some despair person, or say, very suffering was going on. Myself has suffered, because I was not able to help the people I could have done it. So it was, very, very difficult time. But what we have learned, we were continuously telling people that please behave properly. We have a COVID appropriate behavior. So you do it. So that is one, that population involvement, the community involvement is always there in these kind of pandemics. But I found that there was nil. Neither the government is trying to involve the community for many activities, like the pandemic, has to be managed by multi-stakeholders. So one of the stakeholders is community. So community was dictated by do this, that, and that is why maybe I think could be the reason why they have not, supported all the time. They were not believing in, the government or say the bodies where they are required. So many stakeholders have not played their role, although every stakeholder in such kind of disaster or say pandemic is required. Everybody has to play a role. Then you said that some of the problem which we have faced in the hospital, we could have done much better. Unfortunately, India, if we talk about this, then they say that we have countries like Italy and USA where the health system is so good. In spite of that, they were, not able to manage the things. So why you are talking about India where the health system is not good? That should not be the justification that, you could have not done. In first wave, we have done much better. But in second wave also, we could have done. Yes, we have less number of beds per 1,000 population or per 10,000 population, whatever you say. The beds, ICU beds are also very less. We have all statistics which are showing that yes, India is not having sufficient number of all the resources which are required to handle the severe case of respiratory disorders. So we require improvement, and that was happened. In first wave, the ventilator was the main target. You want to have the many ventilator, but in second, it was not ventilator, it was oxygen and some other things which are becoming the various the problem. So what I want to say that pandemic is teaching something, but human being has to learn from it and to implement it in coming time, which is not happening, which is still I'm seeing every day. I am interacting with the reporters and news reporters and teaching them, telling them, but conditions is same. Still people have doubt on the vaccination, although some amount of vaccination is increased, but they have so many doubts of vaccination and so many doubts of the mask. So many problems are there with, but yes, some change has occurred. That's good. That is expected also, but should have been much better. I will say again, it could have been much better. It's not there. I'll not speak anything about the government and other.
Can I add
bodies.
one thing before we go to the other panelist, what Jugal Kishore has said?
Yeah.
What I'm saying, just one point which I would quickly like to add, that it's this pandemic has created a lot of confusion in addressing this issue also. Like sitting as a common citizen and who are watching television or having a digital device with the person, like mobile phones and all, thousands of literature pouring down every day. And also the kind of treatment which is happening. At times people are running for remdesivir, at times people are running for this plasma, and both are now today is not acknowledged as a kind of a medical this. So these kind of things are also leading to confusion. Many recently we conducted one webinar, and where we had a representation from different squatters. The squatters were the slums and all. And there we found out of 20, it's almost 19, which was reported not a single case of COVID-19 without practicing. They are not practicing appropriate behavior. So that is another story which are coming up. Even the Bihar Musahar communities, with them they are working and they live like differently, a different life, all in the open and everything. But there are not a single case was reported from the Musahar community. So this is also making people confused, that one community is getting affected, another is not getting affected. Somebody is saying that probably by wearing mask and sanitizing ourselves, probably we are reducing our own immunity system. So this kind of a confusion, how to be demystify, because this is again coming up again and again. The medical practitioners are also not giving an appropriate answer to the question, especially on the treatment side. Sometimes we say that Ayurveda is working, homegrown system is not working, Dadima process is working, and at times we are saying that only 80% getting recovered at home and only 20% required hospitalization. So 80% is dependent on the home kind of a Dadima solution, and the other 20% is requiring all the medical intervention. So all these created a whole lot of confusion. So that has to be clarified before the third wave. I think that would be very, very important.
Right, absolutely. I think on one side there is misinformation, on the other side there is over-information, and then on the other side there is information from too many sources, and then you kind of don't know what to rely on, what not to rely on.
We are also like a COVID-19 virus. Now every time we are changing. Mutations or हमारे विचारों में.
That's right, sir. Thank you. So thank you for that, Dr. Jugal and Professor Santosh. I'm going to move to Dr. Gita actually with my next question, because while there has been emphasis on the stresses that the healthcare system has faced and the economies have faced, I think one of the major things that was impacted was education, especially when we talk about children and then students who are in college and high school, and there were a lot of stresses on them. So there was a transition, sudden transition, where the education system had to move from offline to online. So how has this impacted the whole education sector? How has the pandemic impacted it?
Thanks, Valerie, for asking this. After 1.5 years, close to 16 months of the school closure, we had a school open for a couple of months in the start of this year, and again it had to be closed. So a couple of thoughts on that. As you rightly said, almost all the children are in a way out of school, and if we all know value of a school institution at a different stage of a life, especially if you look at the children who are in early years, they don't not learn those subject matter, they also learn social skills. There is also the social interaction happening, and also making friendship, relationship with the peers, and that's a lifelong learning, and which not just only nurture their own life, but it also valued for the future. And children are now deprived of those social interaction, the relationship, the friendship they could have made, but they are not able to make. What is happening now, and when we have interacted with the community, the parents, and the children themselves, there is a stress and anxiety, and I think it is also leading to a lot of anger and frustration and violence within the family, within the children, because children are also frustrated sitting with this computer screen on for 6 to 7 hours a day. If it's not the school who is taking the classes, it will be maybe the tuitions that parents have arranged for them. And the situation becomes a bit complicated if they have working parents, because there's a lot of emphasis on parents needs to spend time with children. They have to have a quality time. But if we look at our home setting, the kind of a structure we have, probably it was all very new for everybody, whether for the school, whether it's for the parents or children. So they have to manage their jobs, which have sort of a turn into the home from work from home, and that is becoming stressful for both the parents. And if we look at various studies that have come up in the last 6 months, there's a high rate of stress has been witnessed amongst parents. And we have seen that many of parents wanting school to be reopened in some measures, so that children do have access to other opportunity. There is another section of our society, and which is almost like a 60% of children who go to either a low fee school or attending public government school in a rural area. And the challenges are very different kind. One, the access to digital divide is huge. Despite shifting to this online digital mode, they haven't been able to shift, because there's only one phone in the family. If we look at even the NASCO data, I think the smartphone penetration is very less in a rural area. I think only 4 out of 10 household has a smartphone, and generally it is in the hand of a father, who is also using it for various other services, access the entitlement and other schemes that are available. And most of the time is out of home. So what is the time you expect children to access that phone, get the homework, work on it, and send it back to the teacher, which is not happening in reality. The other part is, even if the parents have a phone, and it also has an issue of data uses, because if you look at a household, their data consumption is also limited, because it's also involved economics, it also involved money, and they are also losing their livelihood. So in a rural area, what we are witnessing is that both at a primary level and also that a senior secondary level, children are actually not accessing even digital education on online education, though they have been reached by the system, by their school, but it's not really effective. And very recently, there was a study done by Ajin Premji University. What they have also witnessed the two phenomena. One phenomena is the learning regression happening. In fact, in all the competencies, children have reversed by 10%. So if they knew mathematics like algebra or fractions, now children have lost that ability. They don't have it. Second is a learning learning engagement aptitude. What we all know and over the years is that children require some kind of a routine and structured life to engage in a learning. And since the schools are not there, the homes do not have a very structured routine engagement, so that aptitude to engage with the learning is also declining. And this is more visible in the family who are living in a rural area, who come from the deprived section of the society, and especially the migrants who have moved from urban to rural settings. So those children are actually at a nexus of, they have migrated, they are in the village, but they are not enrolled in the school, and even a very limited interaction that could have happened with children, which is not happening. So that is happening at the level of the children, where the learning is lost, their mental health is affected, their learning disposition has also gone down, and they are in a all practical sense, they are out of school. And now we look at the government system, which is the school. What has happened? Teachers are the one who are actually teach children in a large private schools. Of course, teachers also had to change themselves. I think it was a huge shift for them. It was not very easy. Many of teachers didn't even have a laptop. They probably never use a PPT. They never use any Zoom calls to interact, but they shifted. And the shift happens so suddenly for everybody. I think we have a doctor here. They will say, when it happened, what kind of a stresses lead to. So what we know, we have a huge percentage of female teacher who have a household responsibility, who have to teach, and they have to learn these new skills and gadgets, and also become an effective teacher. So that's a lot has happened at the level of teachers. They are also going through this huge shift. And there is another set of a teacher. We have a government school teacher who are a part of this whole health drive. I think though we are talking about a lot of health sector professional, whether it's ANM, Asha Didi, even the people who work at the CIC and PCA level, I think teachers have also played a critical role, not in just in second wave, even in the wave one, where they were helping migrants come back, settling in the villages, ensuring there is some kind of a quarantine happening. And now I think in most of the state, teachers are busy in the vaccination drive. They are arranging community because they do have a connect with the community. And what we know, there is a vaccination, fear, and they are the one who are trying to motivate, parents to come, get vaccinated and come around it. So they do also have a lot of responsibility at this point of time. What essentially it leads to both COVID-1 and COVID-2 had changed education system in a drastic way. However, we haven't been able to acknowledge that in last 1.5 discourse, except saying that children are losing their learning. But I think we need to recognize that education system has to go through a change. And now as we are moving, and I think it looks like a phenomena where we'll have this phase of locking and unlocking, we have to restore education in some meaningful way. Last point here is that a lot of restriction came in a COVID when I think we all were unaware and didn't know what going to work. So we all had this national rules and state rule coming, this needs to be closed and this needs to be shut. I think now we have learned quite a bit about what needs to be closed to what extent. I think that need a little bit more thinking as we look at India as a country. I think we need to look at this lockdown also slightly differently from education perspective. Can we open some site of learning where there's no pandemic, where children and teachers are living in the same community? Because if we look at the villages, there's a very strong bond happening. Children are anyway interacting. They are in the gullies and mohalla. They are playing around. Even if you have a lockdown, no, it's not followed. Not that it's followed because this is a very close-knit society or the community. So can we think of alternate approach for education sector as we move forward? So I'll pause here.
Thank you so much. I think it was important to understand this from an education perspective also. And I would now like to move to Mr. Manjeet. So I would like to understand from you that when we talk about ecological systems and health, in that context, what have been our learnings from the last lockdown, from the last first wave of the pandemic, and now coming into the second wave and then unlocking into the second wave? So what has been our learnings in there?
Right. Thanks, Valerie. And first of all, thanks to Sphere for organizing these very regular informative sessions that you do on a very, very regular basis. So one has been this learning, certainly coming from the pandemic. And I also appreciate the design of this session, where you have the panelists from different sectors, and the common thread which is which is joining us all is the overall sustainable development, when we are either talking about disaster preparedness, public health, education, environment and public health. So I think so that's is really, really interesting. But again, I think going back to what you asked, I think COVID-19, certainly, I don't think so. I have to say it now in any different words that it has been a greatest global shock in many decades, or in fact, kind of a century as well. And we have already seen hundreds and thousands of kind of lives which have been lost, and the world's economy which kind of faces the worst of the recession now since the 1930s. And certainly the resulting which kind of the loss of employment and income, which kind of my other speakers have also kind of alluded to, will certainly cause further damage to the livelihoods and the health and education, which I think Dr. Gita was already referring to. And as kind of infections spread, the lack of the universal health coverage, which has kind of left billions and billions of people, and I think that's what Dr. Jugal alluded to as well, including many in the rich countries as well, without reliable and affordable access to medical treatment. The health systems were under tremendous pressure everywhere, whether it was the Western countries or whether we kind of we recently saw even in our own country during April and May. And the point which I want to make out here is this kind of the massive inequalities which kind of have meant that these deaths and the loss of livelihoods have been driven strongly kind of driven by the socioeconomic status, and often compounded by the gender and other issues. And I think that's what even Dr. Gita also referred to when she kind of talked about the whole digital divide. So this whole socioeconomic status kind of there has been a more profound impact on the vulnerable sector. But so this has been kind of we have been talking about, there was a lot of pain which kind of we have seen through over the last 1.5 years. But somewhere this painful lockdowns which have brought down all this kind of loss of employment, everything, they also gave us somewhere a glimpse of a cleaner future. And we all when during March and April of 2020, when we kind of we all were appreciating those blue skies and kind of lots of visibility due to less of particulate matter. Himalayas, we didn't even have to travel. They were visible from our balconies and the kind of the bedrooms of many of the Indian cities as well. So, and we saw clean waters. Yamuna was kind of so it kind of somewhere there was a glimpse of hope, a kind of a glimpse of brighter future, I would say. So what's the point which I think this what's the learning? So it's very clear that kind of attempting to save money by neglecting this environmental protection, and it's not only environmental protection, and even kind of emergency preparedness, or even the health systems and overall the social safety nets, when we talk about, has certainly proven to be a false economy. And now when kind of this generation, we are paying that bill many times over. We have talked about trillions of dollars being lost, whether it's lockdowns or health systems. So we are paying that bill many times over. So so that has been the issue. And the world kind of cannot afford these repeated disasters on the scale of COVID-19, whether they are triggered by the next pandemic, or from kind of now the mounting environmental damage and the climate change. So going back to, if we say that we need to kind of go back to normal, I think so that will be good enough to go back to normal. So and we kind of see an opportunity as well, because governments are now committing kind of trillions of dollars in form of fiscal stimulus, and every kind of government is talking about fiscal stimulus to maintain and eventually resuscitate the economic activity. And so these investments, which kind of have become essential to safeguard the people's livelihoods and therefore their health. But the allocation to these investments and the policy decisions that will guide both the short-term and the long-term recovery have the potential to shape up the way we kind of we live our lives, work, and kind of even consume for many years to come. So nowhere kind of is this more important, I would say, than in the effects on environmental degradation and pollution, and particularly on the greenhouse gas emissions that are kind of driving this global warming and the overall climate kind of crisis. So I think just to conclude, and since it's kind of a very difficult time of the day after a lunch session, so maybe many of us would already be. So I think the decisions which are coming to be made in the months I think I go back to we are all talking about locking and unlocking. I think we have forgotten Amitabh Bachchan ji, which kind of no KBC में पूछते थे ताला लगा दिया जाए. So I think coming months में all the governments kind of the प्रकृति हमसे पूछ रही है कि किस पे ताला लगाना है, ऑप्शन ए या ऑप्शन बी पे. तो एक ऑप्शन ए तो है कि इकोनॉमिक डेवलपमेंट्स जो कि अभी तक हम करते आ रहे हैं विद काइंड ऑफ द परमानेंट एंड एस्केलेटिंग डैमेज टू द इकोलॉजिकल सिस्टम्स विच काइंड ऑफ और हमारी हेल्थ पे, या अगर हम ऑप्शन बी लेना चाहते हैं, उस पे ताला लगाना चाहते हैं, वेयर इट्स काइंड ऑफ वाइजली टेकन एंड प्रमोट अ मोर काइंड ऑफ a healthier, fairer and greener world. So I think the governments need to really take that decision kind of so where they want to kind of spend their dollars on, or किस ऑप्शन पे उनको ताला लगाना है. So that's the choice which I think has to be made in these coming months. So I think I'll stop here and maybe wait for your next questions. Over to you, Valerie. Thank you.
That's a very interesting way of putting that forward. It also helps us understand where our priorities should lie. We are cognizant of the fact that Dr. Jugal has to leave by 4. So
okay. Valerie, you're not audible to us. I think your network has stranded.
So what I'm going to do is I'm going to ask you 2 questions, one after the other, and maybe you can address it for us. So the psychosocial concerns that have come up, I mean, there has. Hi, am I audible now? I'm so sorry, I think I lost. Right, sir. So I was just saying that we are
on for some time.
Okay, great. So, Dr. Jugal, I was asking you that there have been cases of, people have faced mental as well a lot in the first wave. And while we are trying to these issues, as we unlock from the second wave, what can we do better to cater to those issues? And second, if we look at some global examples on how healthcare systems I mean, of course, we have spoken about the improvement of healthcare systems, but if we also look at some global examples, or for example, last session, so we were talking about how there need to be more human resources in terms of healthcare, how there needs to be more decentralization. So can you give us some key suggestions on when we unlock now, what are the things that we can do first in the healthcare system and second for the psychosocial issues? Thank you.
Yeah, Larry, thank you. I leave at 4 o'clock. I just want to say that what the health system can do, as far as the health, mental health is concerned, the number of mental health disorder is increasing, and we have to witness more post-traumatic syndromes, and particularly anxiety syndrome. Anxiety, there are a number of disorders under anxiety. And depression is also seen in many of the cases. Suicide has gone up, and it is because of not directly by the pandemic, but the effect of the pandemic, like the lockdown, and then you are losing the wages, and you have lost your family member, and so these are all compounding things and increasing the mental health burden. So we have to prepare our society for handling, and we have to make our resilient society. So in that, more preparedness is required, more planning is required, where we can handle a comprehensive way, not just the health but also the mental health should go hand in hand when we are planning something and designing something. So that is what is required. So some group has come up. I am working in the ministry, which are looking into that, how we can train our local health volunteers in mental health. And already NIMHANS and ICMR has developed the module, and these modules should be, our workers should be trained and they can look after some of the mental health issues at the very periphery, like the village and local level. So that process is going on. We have to make it much faster because the turmoil is going on, the suffering is already going on. So faster we are, I think we can save a lot of people from suffering. When you say what is required for health system, we have the norms, and those norms should be, fulfilled by all the governments, and our government should also look into that how many beds are required for a particular area. So like we have the primary health center and community health center, they are having the specific norms for the population. And when we talk about primary health center, then there are standards. The government, we have prepared the public health standards for the primary health center, sub-center. These all standards were made by the public health specialists, and they are still not implemented in, true sense. If we can do it, I think every primary health center should have at least 2 oxygen cylinder. If you go today, then we don't find any oxygen cylinder in our sub-center or primary health center. But according to the requirements, according to standards, these cylinder can be available. You can imagine that if our primary health center has the cylinder, at least we could have managed so many casualty which has occurred during this second wave. Similarly, we have to see that our quality of services should improve. Our specialists are not there in majority of community health center and district hospital. We have the 100-bedded wards, and there you will find that we don't have ICU. If ICU beds are there, like the 2 or 3 ICU beds are there, then we don't have the anesthetist. So there's no use of those ICU beds if we don't have the specialist who can run it. So you can see that we have requirement of our specialists at all the levels. We require resources at all levels, and it is not difficult. The government is dedicated that yes, health system is to be improved, but that dedication should be seen in in terms of allocation of resources. It should not be that just talk that yes, health is very high priority for state and the central government, but when it comes to the allocation of budget or allocation of, then the things are not according to. So it is not always. Fortunately, we are in democratic country and our system is socialist, but unfortunately that is only for 20% of the population. We have a socialist like the public health system. Otherwise 80% of our population is already going to private. So you can imagine that in private during this pandemic we have seen how badly they have been treated in private institutions. So somehow we have to strengthen our public health system. Then only our poor people can have some kind of solace or maybe help. I'll tell you that during this, not only this pandemic, but we have example that all the pandemics or disaster where the rich are trying to siphon or say gather all resources, which we have seen this also. The rich people were having the cylinders, they have remdesivir or stockpiled in their home, and it was not available to those who are needing it. So this whole mismanagement has occurred because of our greed, because of our black marketing, because of our mismanagement of our system, or say your law and order system. So if all these things can be managed through our civilized sense of the society, which is not there. We don't are civilized. We are not looking for others. We are not acting like a civilized citizen. That is why this problem has occurred. So wherever we have very good civilized society, we can manage all these things. So that is what I wanted to say. There are so many things to discuss, but I think that is what I just want to highlight.
Right, sir. And sir, before you just leave, maybe if you could also help us understand what role the CSOs can play to support the healthcare system, and also you've already mentioned that local volunteers can be trained in mental health, so that at the periphery level they can. So that is something that the CSOs can support. In terms of healthcare system, medical system, what can the CSOs do?
Yeah, in India, we require this group or community, welfare groups are required. Actually, it is to generate the community participation or community empowerment. These are the areas where the community organizations can play a role, where they can become part of the system. They can become part of, the pandemic management. There was so much gaps, as Dr. Santosh was telling, so much confusion, so much, it is only because every society is playing its own, and they were not having any kind of comprehensive interaction to understand what is the problem and how it has to be dealt with. Everybody is dealing with their own way, and every state is, trying to do their own way of management of the. So these all big community health organization or community organization, can come together and empower the people, because they are closer to community, and they are, people believe on them, they have faith. So if they provide a good information, definitely it can improve. So we can help in vaccination, they can go forward to improve the vaccination coverage. They can also provide the food, like, nowadays we have so much problem of people who do not have the jobs. I know myself, so many families are there, they do not have, and every day they are in a turmoil, they are begging from here and there. So we can have some kind of, where we can place them, or where we can, engage them in some kind of activities. So at least in the end they are engaged and also get something to eat or something to survive. So these are the things I feel this can play. And when we talk about this health, in health, majorly it was actually our public health system of the ground level was totally neglected. Our health centers were closed down, our minor hospitals were closed down. It was the only major hospitals which were doing this pandemic work, and there too, only COVID, no other activities. So you know somewhere, we have not engaged all system. So this organization could have been, involved in running the centers and continuously doing it. Like in Delhi, the Mohalla clinic, they were closed down, although they were the very good source of providing health services. So they could have continued and could have 2-3 cylinders, and health system should continue in that way, but somehow it was not done. So that is what I wanted to say.
Okay, thank you for those recommendations, sir, and thank you for your time today. We are cognizant
Thank
of
you.
the time.
Thank you.
We have to leave soon, but thank you for all of your inputs on this session. It is a pleasure having you as always.
Thank you, sir. Thank you, ma'am. Thank you.
I would like to move to.
Thank you.
I would like to move to Professor Santosh with my next question. So while Professor Jugal has helped us give some suggestions about during this unlocking what we can do to help with the healthcare systems, if you could also give us a perspective on a much macro level, like as a country and not as a specific sector, but as a country on a macro level, at maybe the policy level, what or at the capacity building level, what are the things that we can do as we unlock again? And the second part of the question would again be the same as I asked Professor Jugal, which is what is this? What is it that the CSOs can do? What role can they play in this unlocking?
I think the 9 empowered group which have been set up by the government, their recommendations should be brought in the public, and aggressive information sharing should be done. And that what they have recommended on oxygen, what they have recommended on public health, what they have recommended on other issues. So that is one thing. The second is important, that how long we are going to be closed. That is the question. Second wave, third wave, fourth wave, fifth wave. We do not know how many waves which we have to face. And as very rightly pointed out by Dr. Gita Verma, the children, the school system, the higher education system, they are losing their whole perspective of life, how they have to move on. Exam is there, exam is not there. Admission would be there, admission will not be there. They will go to IIT and they will not go to IIT, whatever. So many of these kind of a confusion. The continuity of education is very, very important. How that we are going to ensure in India with the help of digitization and also opening up with a strict sense of compliance of the appropriate COVID behavior by the institution, those who are into a school management system, those who are into colleges, and also those who are into a kind of a movement of people from home to home. And the children go from home to the school, and they take a different mode of transport. And if mode of transport is not into appropriate COVID behavior, if 20 children are required to be sit in the bus as per the appropriate COVID behavior, there should not be 40 or 50, the full capacity should go into that. Whether the drivers, whether the service providers are actually adhering to those strict norms. So there is a second macro intervention, which I would say, that will go irrespective of the states. Every state, although this is a state subject, but every state has to ensure that first they have to agree on that we have to open and we have to fight with this COVID-19. So that if we have to agree on that, then we have to go for vaccination also. So that vaccination drive has to be taken as a very fast forward kind of a. So the availability by the system and informing people about the beauty of vaccination, that how they can protect. So that is, and clear demystification of if anything goes wrong with the vaccination, because the bad news is spread faster than the good news. The recent study I was going through, New York Times had conducted, that how the bad news had traveled this time during the COVID-19 very fast in a way, and then the good news about the COVID, that what are the practices to be done. So that we need to take care of the rumors and other things. The fourth thing which I would like to mention as a macro level is the resources. We need to look at for the additional resources when we are preparing for disaster and also preparing for the COVID-19. That resource allocation has to be done in terms of that kind of a very, very kind of a judicious one, like Prime Minister has given 20 lakh crores of recovery, and major focus has been given on the health sector. So if we wish to actually improve economy and open up, and then we have to have a kind of a faith in vaccination. That is the only which we say that solution and the confidence. So vaccine with the appropriate COVID behavior. These two have to be kind of on a war footing level. So that probably will be able to take care of the third wave also, and probably the fear of the another wave after wave could be. So that I was saying that how effectively that 15th Finance Commission recommendations given by the Finance Commission to be utilized for a different sector while going for the capacity building. So that capacity building, that money is available, they are having that resources, how effectively that can be put to use for the preparedness, and which is a multi-hazard preparedness, which I'm saying. And there the role of community organization I see as a kind of a very, very important. So community, without community, we cannot fight any battle, whether it's a disaster or whether it's a pandemic. if we are thinking that we can do it, probably we are living in a kind of a illusions. So that illusion has to be broken, and that see that how community can be a part and parcel of the system, and how system can also get integrated with the community initiatives. It's not that every time community has to go and get integrated with the system. Wherever the communities stories, like I was seeing in Kerala flood, community story was very strong. Many Bihar floods, so their community initiatives were very strong at the local level. So what I'm saying is, where the communities, institution systems are strong, government can very well facilitate and get integrated with the community. Not necessarily that they take the first role. Let the lead role be in the community, and then government should facilitate. So there I see as a kind of a... And last point, which I would like to mention, that Disaster Management Act. We are using Disaster Management Act for pandemic management, but the provisions of the Disaster Management Act are not actually capitalized for the management of resources. So there we can see that how that can help together in building those issues for the third wave, preparedness for the third wave. And of course, last point, but the DM Act enforcement, that there is a provision that government can overtake all the private resources as well. So if government is not doing, it's fine, but the responsibility of the private sector is much more, as the 70% of the health facilities lying with the private sector. So if private sector is envisaging, they should assess that what on the basis of the second wave, that how much that they will have the pressure on the hospital. And accordingly, they should also start assembling their own resources, organizing their own resources. So that is important. They should not leave it everything on the government. So that's what happened this time. And even if I can't name the hospital, but they were blaming government that you did not provide hospital. Do you share the profit with the government? You don't share the profit with the government. So you should, when you are treating, you take this responsibility that it's not only that you have to mint money, but the whole country is into crisis. And this crisis, they should also come forward proactively. And I'm happy that many hospitals came up, but many also expecting from the government all the time that they should provide. So what I'm saying is have a dialogue before the crisis with the government, and see that what is available with the government and what government can supplement with, and what that private sector can bring on the plate. So that, yes, this is that there. So that government can also assess that what is more to be added, and then the rural issues would be definitely there. How A&M and others could go for a high-speed capacity development program, so that the Tikakaran and also Tikotsav should be taken as a forefront there. And without training of the A&M and others, they can't do that. So that will otherwise remain as a challenge in escalating the whole problem of third wave and the fourth wave, as long as that people are not vaccinated and not having this appropriate behavior. Like if I can see in the metro, the monkey can enter, so the virus can very well enter. So I was just seeing this is happening it very well in the malls, when you see that people are just not recognizing that still second wave memory. So that second wave memory should be always be reminded to them that for following this COVID appropriate behavior. So these are the things which I wanted to flag at this point.
Right. Thank you so much, Santosh, sir, for those inputs. I will be summarizing this at the end of the session. My next question will be to Dr. Gita. If Dr. Gita, if you can help us understand now this in the context of education, that while we unlock from this wave 2, and what are the things that the education sector can do, in the sense that you've already mentioned about, you mentioned about some modes of learning that we can adopt during unlocking. If you can help us understand what are these alternate approaches that can be taken, what are these modes of learning that we can adopt, and especially for those children who are in the rural areas or are studying in low fee schools. So the first part of the question is that. And the second part of the question again is what is it that the CSOs can do in for contributing towards this?
Sure. I think I'll pick up on what other panelists have just mentioned about CSO or the community engagement. I'm trying to bring both these groups together. What I think probably we need to do, and this is something we haven't done the way probably we would have done, how to involve village panchayat and local youth group into the education for at least for children. What we have seen mainly, we've been dependent on the teachers and teachers reaching out to children. I think we have to do a lot of unlearning, and that essentially means, can we have a more better village-based system to support children? Not to say that they will replace it. I think when we are talking of an emergency and pandemic situation, we have to look at all possible ways to reaching out to. And when the situation gets normal, then the school, of course, is the site where children move to. So first and foremost, to my mind, when we are looking at unlocking, especially reaching out to marginal children in a rural area, especially, we need to look at even reopening of probably some of the schools. If you look at Odisha, Jharkhand, Chhattisgarh, many parts of India, and who do not have even access to internet. And we do know that teachers live in the community and they are nearby. Can we think of opening those schools in a phased manner, block by block? I think instead of having this a statewide closure, we now need to look at the block-wise block approach of opening the school. Even if those situations arise, can we invoke village panchayat to take a responsibility of ensuring children get some meaningful interaction through local youth and community? Can we create a cadre for local youth with minimal training, some support to engage with the children? That could be another way of looking at. And similarly, I think what we have lacked in last 1.5 years, that the efforts have been taken by many civil society organizations, but they have been a very individual effort. I think what we needed more both at the national and the state level, more concerted dialogue and discussion between the department and the CSO coming together. What are the possible ways to reaching out? Of course, digital was one way which has been there, but we all know, and there are now tons of information coming, is not sufficient. It's not to say that it needs to be changed, but we need more options. Digital cannot be just one option, and one or other options could be having this small group working with children, having panchayat working with children, have opening some school in isolated where there's no infection, and for over the last 6 months, can we open those schools when we haven't seen any history of it? And other thing, I think what we also need to do, vaccination of all the teachers, vaccination of all the staff, make that as a priority. Many states have done it, many states haven't done it. We know our children are not going to be vaccinated till next year because vaccine is not available, which is under trial right now. So are we saying that we are going to be in a digital mode? At the same time, we are saying digital fatigue is leading to mental stress. There is overexposure to screen, which has a long-term impact, that we are not forcing right now. Maybe a few years down the line, we'll see this generation of children who are exposed to this extreme screen time for longer period may have some kind of effect. I think there are many studies which had indicated to us that children should not be exposed to more than 1 hour of screen time in a normal scenario, but immediately we move from moving to the complete screen time. So can we also looking at limiting this screen time for children? What is that minimal? What we also saying, many of the schools are looking at a school curriculum the way it was, but I think for the next 1.5 years we have to look at a school curriculum very, very differently, where social interaction, this mental health, other aptitudes are as critical as a learning aid. But I think we need to see the next 1.5 years very differently, working with our teachers to learn those skills to work with children. I think when we school reopen, our children will not be the same. They have gone through tremendous things. We have to acknowledge. Our teachers are not the same. They have also changed because they have also lost their families, friends. They have been these duties for COVID. Even if they are vaccinated, they have a children they didn't know, and now they don't even have those tools to engage in. So how do we really help our children? And also our system at a district and below level. I think we do not pay a lot of attention to those district and below level systems. How do we really equip them? And the other is our complete the private schools. I think they also need some kind of a guidance and work with, because many of the schools are working with a good intention, but they also lack framework, they also lack guidance. I think we need to come up with those specific areas to work on as we not get into the unlocking. I think even if we prepare for the next 1 year, so preparation has to start now. We have to restore education. We have to ensure the investment in education do not go down, which is already below the optimal level, but we should not cut down on budgets. We have to make sure that the education is as important as health as an emergency, because then we will be dealing with education emergency after 5 years down. So this generation is critical. India has almost 54% of children who are under 18. So we are talking about half of India right now. So I think let's not ignore half of India.
I think that's actually a very impactful statistic when we look at it from that perspective, that more than half of our population is going through challenges more than the others. I would like to move with my last question to Mr. Manjeet, after which we will be taking question and answers. Dr. Manjeet, if you can help us understand that when we talk about health and green recovery and also sustainable development, what are the major prescriptions of WHO, and how can these prescriptions be implemented during this unlocking? And the second part of the question would be, is there anything that CSOs can do to help with this? Thank you.
Right, thank you, Valerie. And I think as I think already see the health professionals and both the doctors and the teachers are kind of the most trusted professionals all across, and I think coming kind of from this sentiment itself. So WHO, as you know, that being a kind of intergovernmental organization, we have this World Health Assembly. So in the 73rd World Health Assembly, which was kind of not the first of its kind, which was conducted online during May, there WHO shared certain kind of key points as a prescription for a healthy and green recovery. And I can kind of go through all these 6 points, but also kind of share what could be under these 6 points when we kind of say what could be some of the action points. And I think, and where CSOs can kind of certainly will have a larger role, and they already have been kind of playing a very, very active role in these kind of sectors. So first kind of prescription what WHO shared, and again these are available on our website as a part of a healthy a roadmap for healthy and green recovery, this document which you can kind of download, and maybe I can also share a link on the chat box as well. So first prescription was certainly to kind of protect and preserve the source of human health, that is nature. And when we kind of talk about this, I think there are some set of actionable points which can kind of talk about. And first and foremost, which kind of come is the biological diversity issue, the whole biodiversity. And I think India is kind of does not need to be retaught on this issue, as because of all our kind of traditional knowledge, and the Vedas have kind of talked about coexistence with nature, and kind of and promoting biodiversity. But certainly when we within this whole framework, what we need to kind of certainly talk about is to certainly implement and update the national biodiversity strategies and action plans which we have. And also, being an agricultural country, we need to kind of promote the agro biodiversity and the use of kind of the integrated pest management, which kind of reduces the need for chemical pesticides and herbicides. And somewhere we again again are a country which is kind of relying a lot on these kind of chemicals. The second within this particular framework of the first prescription would be this whole issue of climate change. And again, when we kind of talk about climate change, this whole mitigation of climate change by kind of certainly reducing the greenhouse gas emissions becomes a very important part, and which can be kind of done through better energy use choices, agriculture practices, or whether it's kind of the transportation practices, the city designs and the city planning, and then no doubt the industrial kind of technologies and the use and the practices of those areas as well. Then kind of also comes areas of air pollution, and there we are kind of talking about developing and implementing multi-sectoral policies and actions which are kind of across various thematic sectors to prevent air pollution. And then kind of becomes an important issue of chemicals, where we kind of India is certainly a party to many of the international conventions, and has ratified many of these international conventions, whether they are the Minamata Convention on Mercury, which India has kind of just a couple of years back, which has kind of been ratified. And again, all these have a lot of ramifications within the health sector as well, because of the mercury being used in the healthcare devices, and also dental amalgams, and also outside the health sector. But again, this is something which is again has to be kind of order whether we kind of talk about the Basel Convention and the Stockholm conventions as well. So that's on the nature aspect. The second part, second prescription which I would like to talk about is investing in essential services, from water and sanitation to clean energy in the healthcare facilities. And if we kind of really talk about healthcare kind of facilities, healthcare facilities also are a major source, apart from whatever curative services they give, they're also becoming a major source of greenhouse gas emissions as well. And if health sector was kind of a country in itself, I think I'm forgetting that statistic, but it would be somewhere around the fifth largest or the sixth largest contributor to the greenhouse gas emissions. So that's kind of a lot of emissions coming from the health sector. So that is where I think kind of investing in these services of kind of whether it's water, providing and promoting the use of giving safe drinking water, having a risk management approach, whether it's sanitation, and kind of promoting and again, when it's not only healthcare facilities, but also certainly kind of what Dr. Gita referred to is in terms of schools as well, and also kind of workplaces and public places. And then hygiene, which has kind of been very much emphasized even during the COVID as one of the COVID appropriate behaviors on strengthening hand washing. And that's where this is an opportunity which kind of has to be continued, and whether it's COVID or whether it's beyond COVID, because this particular one of the cheapest and kind of the most least expensive public health measure, which can bring in a lot of kind of benefits in reducing the disease burden, not only in COVID, but also in kind of other communicable diseases as well. And then talking about clean energy, where we are kind of talking about providing and using of clean and safe cooking and heating and lighting kind of solutions for, and we already see in the country a lot of work being done for on solarization of the PHCs, the primary health centers, and where kind of states of, for example, Chhattisgarh has done a lot on this. And especially there's an opportunity when we are talking about vaccinating such large numbers. I think that is where our kind of the cold chain, in order to maintain the cold chain, and what we have also kind of seen in polio, we need to kind of really upscale this whole renewable energy aspect, and kind of our vaccinations kind of the cold chains can be kind of done through this particular thing. Then is kind of certainly talking about ensuring a quick healthy energy transition, which is kind of a rapid transition away from the fossil fuels and kind of towards the low emission fuels and energy sources, whether it's the solar or whether it's the wind, kind of moving towards that. And the fourth prescription, which kind of WHO has given, is kind of talking about the promoting and healthy and sustainable food systems. And when we kind of talk about food systems, I think it really mentions that there are two kinds of these days issues which are kind of arising out of food systems. in terms of diseases which are caused either by lack of access to food, or maybe consumption of maybe the unhealthy and high calorie diets, which are kind of becoming the single largest cause of global ill health. So that's like kind of coming from the obesity aspect. So that's where this whole kind of prescription and actionable points on food system becomes very important. The fifth important point, I think, and that's where for India it's very important, is in terms of building healthy and livable cities. Our whole kind of smart city mission and kind of whether it was Amrut, or so there are a lot of kind of government resources which are being pumped into cities, and I think that's why we need to be kind of making sure that we integrate health into the urban planning policies to kind of really deliver a highly connected and mixed use and compact neighborhoods that could be kind of economically and socially viable, and certainly improving the walking and the cycling infrastructure for people of all ages and kind of abilities. So and then plan places which are kind of more resilient to climate change and natural disasters, and certainly not to kind of forget about the clean air aspect and also access to water, adequate water sanitation, and certainly the hygiene infrastructure, which certainly kind of COVID has really emphasized the whole importance. And then last but not the least, I think we have talked about fiscal allocations, and there stop using kind of taxpayers money to kind of fund pollution, and that's where we need to kind of really stop subsidies on fossil fuels. And we see our country, where India has kind of embarked on this particular journey in terms of reducing the subsidies on diesel and kind of also on petrol, and that's where we need to kind of stop this and which is for power generation and also transport, and or subsidize or exempt kind of tax on clean energies, and give those kind of subsidies on clean energies such as kind of solar and wind based kind of electricity. So that's kind of on the healthy prescription. But also there, as I say that again, it is not only all the actions lie within the health sector. I think for this there are a lot of kind of determinants which are outside the health sector, and that's why you need a very coherent and intersectoral approach. And that's where that whole kind of discourse on strengthening and supporting implementation of health in all policies, which kind of has to be advocated at all the levels, and then mainstreaming kind of health and well-being becomes an important aspect of it. So I think those are some of the aspects which I would like to kind of mention in terms of the healthy prescription and some of the actionable points. And where kind of the CSOs have been kind of doing a lot of work, I think, in the country. When we talk about any of these points, whether we talk about biological diversity, we have already seen a lot of kind of civil society organization which have worked a lot on whether it's kind of the afforestation process, or maybe making the communities aware about and kind of the whole joint forest management, if we kind of look at, I think has been from a major success because of the kind of the role of the CSOs. So we see a lot of continuous engagement from the civil society organizations on these issues, and especially when kind of India is also kind of implementing big programs, whether they are the National Clean Air Program or maybe the Jal Jeevan Mission, which have kind of got huge allocation. I think the engagement with the communities would be very important to really move from these allocations to really achieving the outcomes which are kind of envisaged in these big programs. I think that's where I would like to stop, and maybe if there are any questions, would like to kind of take it. Thank you so much. Over to you, Valerie.
Thank you, Mr. Manjeet. Hearing you just makes me feel like there is another dedicated session just required to go through these 6 recommendations in detail, and also see their intersectionality with other sectors. So I think that is something that I'm also going to take back from the session and see if we can plan something on that. We have one hand raised by Mr. Javed. I'm going to send you a request to unmute. If you could just unmute and ask your question, Mr. Javed.
Thank you, ma'am. This is Javed from Jammu and Kashmir. I am from disability sector, and I just want to say about the inclusion. What trend should we do for including the person with disabilities in the unlocking process? And there are a lot of challenges with the children with disabilities. We don't have facilities for even now our children are mostly dropped out from the educational processes. Those who are deaf and are mute and are not in a position to communicate their problems have a lot of difficulties. There were so many cases of sexual abuse among the children having these type of disabilities like communication barriers, and we couldn't help them a lot. We It was a neglected kind of the part of society during the pandemics. And as you know that a person with disabilities cannot think of more social distancing, using the masks, and having lot of sanitization. Some don't have the hands, some are wheelchair users. They are mostly carried to other places, even to washrooms for maintaining their personal hygiene. Some are bedridden, and some person with disabilities have communication barrier, so they always read lips, and using the mask creates another barrier for them. So there are a lot of difficulties which a person with disabilities face in day-to-day life, and risky situations, pandemics have added a lot of other things with them. So how can we what will be your suggestions, what WHO suggests, what other people who are in the who are giving us suggestions about the unlocking process, what do they suggest about the inclusion and how to give impetus to the person with disability so that they too are not left behind?
Right. Thank you so much for that that very relevant question, Mr. Javed. Dr. Geeta, Mr. Manjeet, if you could just help us understand that, because Professor Santosh and Dr. Jugal are not here, but maybe from the education perspective of children with disabilities, Dr. Geeta, you can help us understand, and if there are any recommendations for inclusion of people with disabilities, Mr. Manjeet, you can help us understand that.
Yeah, thanks. That's actually a very, very valid observation, Javed. Thanks for bringing that out here, because we tend to ignore, not just ignore, because we make everything mainstream and homogeneous while things may not be. Well, I'm not a disability expert, but what I can share is that when we are looking at various sectors where there's a health and education, I think we also have to do a mapping action plan based on different children. One is, of course, children, people with a disability, and disability of a different kind. You rightly mentioned masking, sanitations, and also having that physical connect is very critical for many of people who are suffering with it. So I think when we are looking at a school and education, there have been some discussion around the guidelines. Also, how do we have these children coming to schools? What kind of action need to be taken? But what will be very important, I think, not just as a community, but at a response to it. I think we do need a very dedicated response to address needs of children who are in a disability. I think that should be one of our advocacy asks at a national and a state level. Something probably a Ministry of Health to consider, and kind of come up with a more specific suggestions. And within the education sector, then education's department of Ministry of Education and Department of Education to come up with education. What we know from our own experience and from education sector is actually children who could get access. These are the children who are the worst affected, and they are the one who have been literally out of the school, no digital education. So one can imagine the kind of a loss and trauma they may be facing. So what kind of a specific package, not a relief package, but I think they will need a more of a concentrated effort to work. Can we have a more home-based care for many of those people and children? Can we have a cadre to work with them the way we are looking at elderly and senior citizens care? I think we also need to think about, and also think about looking at a school and opening in a more of a phased manner, where we can have the children coming for a specific hour, interact, I think, and I'm not a health expert, but what I'm here is that children do have a certain way of immunity if we are able to maintain this COVID behavior with masking, maintaining those distances, and the environment is a safe and a clean. I think many of the risks can be minimized. So from that point of view, what I really urge, we all need to look at how do we really bring the children or the people back into the school and institution, and also in the public places. We do need to do a serious thinking. Thanks, Javed, for highlighting.
Thank you, Dr. Geeta. Manjeet, would you like to add to that?
Not much. I think Dr. Geeta has certainly covered it quite well, and certainly kind of thank you, Javed ji, for asking this very kind of pertinent question. As I think we all are kind of very well aware that certainly kind of people with disability certainly kind of experience I would say the poorer health outcomes, and they have certainly kind of less access also to education and work opportunities, and due to which all of this kind of are more likely to kind of live in poverty than those kind of without a disability. And kind of since you said about WHO, and I would kind of say that I'm not a kind of disability expert, but yes, the organization has been working on this particular issue, and so there has been as I said, like being an intergovernmental organization, many times disability has been taken up even in the highest body, which is the World Health Assembly. And I think even in 2013 there was a resolution which was in the 66th World Health Assembly, kind of where they kind of talked about the resolution on disability, including kind of prevention, management, and rehabilitation. But I think that's history. But in terms of the COVID, this becomes a very, very important point, and I think there is a lot of work which is kind of being done in various ministries, including Ministry of Health. But I think much more work is required to certainly kind of meet the needs of our kind of fellow country people who are kind of suffering from this. So I think much more work is required, and I think maybe I can share with you some resources, and I can also link you up with people who are kind of taking care of this particular issue, and I think you can have a much larger discussion and with those people. So thank you, and over from my side.
Thank you, Mr. Manjeet. And Mr. Javed, I'd also like to bring to your notice that we did have a separate session where we covered the protection concerns for people with disabilities, where we did talk about the accessibility for vaccination, which you also pointed out as a issue for people with disabilities. So I will connect with you bilaterally and share with you some resources on that. With that, I'd just like to summarize the points that were made by all of our panelists, where Professor Jugal emphasized on the post-traumatic and anxiety syndrome and the suicides which have gone up, which may not be a direct impact of the pandemic, but which has certainly compounded this, and we as a society have to be prepared for handling this. There was a recommendation of training local volunteers in mental health, so that at the periphery level, mental health issues can be dealt with. When talking about the health systems, it was emphasized that the norms should be fulfilled, the public health standards for the public health centers should be implemented. The minimum requirements like 2 oxygen cylinders or PHC should definitely be in place. The strengthening of public health system is one thing that most of our panelists emphasized on. And in terms of participation of CSOs, it was said that the CSOs can play a huge role in generating community participation, awareness, empowerment, increasing vaccination coverage, and also with running of the public health systems. Professor Santosh said that the 9 empowered groups recommendations should now sort of be integrated and brought into public and implemented, whether it is about oxygen or vaccination. The continuity of education is also something that was emphasized by him, as well as Dr. Geeta. The other macro recommendation that he made was, the unlocking should be in strict compliance with COVID appropriate behavior, the vaccination drive, the traveling of information, whether it is good or bad information, should be responsible, and we should look for additional resources for disaster management. In terms of role of CSOs, DM Act enforcement, and the integration of systems and CSOs was emphasized on. Dr. Gita also emphasized on reopening of some schools in a phased manner, which could be block-wise instead of state-wise, and the contribution that the village panchayats can make, in terms of social engagement. And apart from digital, what are the other ways that we can explore? Because since we know there are a lot of people who don't have access to this digital means. The vaccination of all staff and teachers was also emphasized on, and it was emphasized that the school curriculum should also be looked at differently with mental health aspects and social interaction aspects there within. Mr. Manjeet focused on the 6 key recommendations for health and green recovery, which we can also take for COVID-19 unlocking, which included protection and preservation of sources of human health, investing in essential services, whether it is wash, health sector, clean energy, and the quick healthy energy transition. And like I said, this is so detailed that I think we really need another session on this. The healthy and sustainable food systems, building healthy and livable cities, and the fiscal allocations in that regard. So thank you all of the panelists. I hope I did manage to cover all the points well. And there are no more questions from the participants, so we are going to close this session. And thank you again, all of you, for your participation.
Thank you
so
very
much, Valerie.
Yeah.
Thank you.
Everyone.
Thank you, Manjeet. Thank you.
Thank you, Dr. Geeta.
Thank
Bye-bye.
Bye-bye. Bye, everybody. Have